Hi, and welcome to Blueprint of an Athlete, where science meets sports. I'm Dr. Robin West. I'm a board-certified orthopedic and sports medicine surgeon, and your host as we explore the intersection of performance, recovery, injury prevention, and innovation. There are countless creams, gels, rubs, and patches on the market, promising relief and recovery. But what actually works and why? Today's guest is someone uniquely qualified to break this down for us. I'm thrilled to be joined by Dr. Brandon Welch, PharmD and president of SportPharm, is a licensed consultant pharmacist and a nationally recognized clinical sports pharmacy expert. He operates at the intersection of pharmacy and sports performance and helps clinicians and athletes apply evidence-based pharmacology in world sports medicine settings. Dr. Welch earned his Doctor of Pharmacology degree from the University of South Florida, and he completed his graduate training in exercise science and human performance at the University of Florida. He is widely known for advancing the role of pharmacist in sports medicine and has served as a clinical sports pharmacist with one of the largest healthcare systems in South Florida. And he's supporting sports medicine physicians, athletic trainers, and elite sports organizations. His experience includes work with professional teams such as the Miami Dolphins and Florida Panthers, as well as a wide range of collegiate programs. In addition to his clinical work, Dr. Welch has authored research on clinical sports pharmacy practice and serves on the advisory boards of the Society of Sports Neuroscience, as well as on the advisory board of Zymogen's athletic sports supplement brand. Brandon, it's so great to have you on the show. Thank you so much for joining us.
I'm delighted and honored to be here and to share some of my experience in this.
Awesome. That's great. I'm sure our listeners are going to learn a ton today. So let's start off basics. What is sports pharmacology?
Great question. And it's a question I actually get quite often. So sports pharmacology is really the intersection of sports medicine, pharmacology, and then also performance. And so we're really looking at how medications and supplements interact with the unique physiology of athletes, taking into account their training load, recovery, competition schedules, competing across time zones, and then those strict anti-doping policies. And if I could illustrate an example of how a sports pharmacist or how someone would define sports pharmacology, is we look at how drugs are essentially affecting performance and recovery. So if we take an athlete that has type 1 diabetes who lives on the East Coast and is traveling to a time zone in the mountains like Colorado, where they're at higher altitude, we would essentially work with their endocrinologist to fine tune some of their insulin medications, make sure they're on a rapid acting medication right before any of their training or competition. You take, for example, athletes that may have asthma or suffer from exercise-induced bronchospasm, making sure that they're taking their inhaler 15 to 30 minutes prior to their performance or training. So that way it's not impacting their training or performance any. Then you have certain medications called SSRIs, selective serotonin reuptake inhibitors, that can be used to treat depression or anxiety, looking at their side effect profile and how that may impact performance. So a lot of antidepressants and anxiety medications can affect some of the electrolyte imbalances, right? And so that can put an athlete at increased risk for like heat illness. So oftentimes we'll be in communication with the primary care physician or the sports dietitian and figure out ways to mitigate some of those side effects. Then we tend to look at some of the kinetics, right, of some of those medications that they may be prescribed for the athletes. Looking at certain therapeutic medications that have more of a less side effect profile or something that's more favorable for an athlete. Now, diving into more of the anti-doping policy, where does sports pharmacology kind of fit in? So we know that athletes need therapeutic use exceptions for certain medications that may be on the banned substance list. Doesn't necessarily mean that they're bad for the athlete. It's just that there needs to be some type of indication for it. So sometimes you'll see, inhalers, right? That's on the banned substance list that may require additional documentation, where in a normal patient population, obviously you don't need that extensive documentation for the general population. Same thing with oral steroid medications for an athlete that may have inflammatory conditions going on or may be suffering from an upper respiratory infection. Then another thing we'll look at is drug-induced nutrient depletion, right? So when we're thinking about sports pharmacology, there's certain medications that affect nutrients. One that quickly comes to mind is in our master athletes. Sometimes they may be taking a statin. And statin's a medication used to help reduce cholesterol and reduce the risk for any type of cardiovascular events. Well, statins, unfortunately, have the side effect of muscle soreness or muscle weakness, right? And so oftentimes it can make it seem like the athlete is working too hard and their muscles aren't recovering as well. Well, usually that side effect profile from taking a statin could be from a depletion of coenzyme Q, right? And so oftentimes that information will be relayed to the dietitian or the primary care physician to say, hey, maybe it's worth this athlete taking a supplement to help augment some of those effects that may be going on from some of those medications that can be causing those nutrient depletions. And so essentially, sports pharmacology is this bucket of looking at medications and supplements and seeing how it can be impacting an athlete's performance.
It's so interesting. I mean, it's such a team effort, right? It's everything plays a role. And so working together with the team, the nutritionist, dietitian, and the athletic trainers, the physicians, it takes a team to keep everyone on the field.
It
But
does. Interdisciplinary collaboration is really how we raise the standard of athlete care.
yeah, it really, really is to optimize them in every way they can. You've talked about a lot of oral medications but I kind of wanted to focus on topical therapies and why have they become such an important part of sports medicine in the past couple of years?
I think topical therapies are really starting to align very well with treating athletes, right? Is because they're effective treatment options with less systemic side effects. So over the years, there's been this growing awareness around some of the downsides of relying too heavily on oral anti-inflammatories. Oral anti-inflammatories have its place, but if you can find something that can be just as effective while minimizing that side effect profile, why not go for it? And so, for example, NSAIDs, taking too much of them or taking them too frequently can increase, your risk of stomach irritation, ulcers, cause your kidneys to work a little bit harder, cardiovascular risk. And we're not just thinking about things for the moment. We're thinking about some of the long-term ramifications if you stay on these different medications. And so essentially, when we think about topicals, specifically for localized injuries, it's more of a targeted approach. It's applying the medication directly to where the injury is at rather than taking an oral medication. It's being distributed all throughout the body. And so I think the reason why topical therapies are becoming a lot more popular is because how targeted and effective we're starting to see them work on the athletes. And I think it can become a big win for athletes who need immediate pain relief.
Yeah, I'm personally a huge fan of them, so I'm a big believer. But there are so many over the counter medications out there. There's BioFreeze, there's Icy Hot, Tiger Balm, Arnicare, Atomic Bomb. But how do clinicians and athletes really differentiate between these products? And does formulation really matter as much as the active ingredient of these?
I mean, man, this is a question I get quite often, especially from the athletic trainers, right? Is what is the best OTC topical product to use? And I always
Yep.
like to say, don't focus on the brand, right? A lot of OTC products are highly commercialized. We need to think about what is the active ingredient and what exactly are we trying to treat, right? And so OTC pain relievers, I like to put them in a few categories, right? And so we have our salicylates, which are like our methyl salicylate, trolamine salicylate, which is what we'll see in like a aspirin cream that work very similar to aspirin, right? And they provide some pain relief is because they have some of that more of an anti-inflammatory effect. So it's targeting some of those inflammatory pathways. Then we have our capsaicin products, which trigger more of a warming sensation, right? So our athletes that like more of that heating sensation, our capsaicin products are essentially depleting substance P, which are working more on our sensory neurons to block or mask any of that pain that we're experiencing. So if you have an athlete that has very tight muscles and we want to loosen those muscles up, capsaicin could be a good product to essentially use. With your experience, Dr. West, working in baseball, the baseball guys, literally, they were lotioning this stuff, by the
I
way.
love it personally. It's like the best. I love it. I like warmth, so I love capsaicin.
Yeah. And then, you have your counter irritants, right? So we think about menthol. Menthol is more of your cooling agent. That tend to works well for any type of musculoskeletal injuries, and camphor, which is kind of like a hybrid between a cooling and a heating agent. And these are good because they stimulate some of those sensory receptors to block any of the pain mechanisms. And then we go more into our herbal and botanical products. So for people who are familiar with like arnica and arnicare, these are typically used for mild bruising, low grade muscle soreness, or soft tissue irritation. Then we have our topical anesthetics, right? We can't forget about lidocaine, which we commonly see inside of brand names like Solonpos. So lidocaine, it's an anesthetic agent. So it mainly numbs or mutes the pain, working on more of our nerve conduction. And then we have, our topical NSAID or diclofenac 1%. And that's very general for any type of anti-inflammatory pain that someone can be dealing with. And so I always tell, our clinicians, athletes, athletic trainers, figure out what the active ingredient is, what exactly it's doing, and what we're trying to treat. And so if I'm using menthol as an example, a cooling agent, and I want someone's muscles to just calm down because they're firing off all the time, then I'm going to use menthol, right? But if I have an athlete that has very tight muscles, then I'm going to use a heating agent like a camphor, or I'm going to use a capsaicin. And then if I have more direct inflammatory pain, then I'm going to use something like a diclofenac. And so it's really about using these products very judiciously and figuring out what exactly we're trying to treat based off the injury and the mechanism for the athlete.
Yeah, it's so interesting. I guess my question to you is people ask me, or athletes always ask me, like, how is this really helping me? Is this just masking my pain? Or how do we know it's going deep in the tissue, and how does it really work?
Yeah. So when it comes to topical therapy, I always like to say it's important to understand the skin and its structural design with all the different layers. And so we have the epidermis, the dermis, the hypodermis. We're going to focus our attention on the epidermis because that's where essentially the topical products are essentially working. So our epidermis is more of our outer protective layer of the skin. It has no blood vessels. And so it's a more of a avascular tissue. And why does this matter? Is because topicals, essentially, when they're applied, they kind of sit at the surface, more of the localized tissue effect. And it's meant for that is because it's not intended to reach some of those meaningful systemic blood levels. Is because when we reach some of those high systemic blood levels, that's when we start to experience some of those side effects, which is why topicals have a lower side effect profile. And so essentially, when we're thinking about how exactly they're working in the epidermis and they're working more on these pain signaling pathways called our superficial sensory nerves. And these are good because they're targeting these nerves because when we experience pain or when we have some type of injury, it's all about, pain pathways we're trying to target. And so while the topicals may not be getting very deep into the tissue, I think the real question to ask is how are topicals effectively blocking those pain pathways, working on our nociceptors, working on those super sensory neurons with how effective it'll be. And I'll give you some really good examples of how topicals can be effective for musculoskeletal pain. And so if you have more of a superficial injury, more of like tennis elbow, golfer's elbow, lateral medial epicondylitis, patella tendons, right? I think topicals can be very effective is because again, those are more superficial injuries. And so how are topicals actually working or if it's really working, they definitely have its place. We always got to think about how it's effectively targeting those pain pathways.
Interesting. There and all these different topical agents. There are creams, there are gels, there are patches. Can you explain the difference, and are they the same, basically?
No, each and every one of them have their place, right? And so when we think about gels are more alcohol or water based. And so they absorb very fast. They have a fast onset of action. The downside is that they don't work as long. And so if I'm thinking about when and why I would use a gel, I'd use it more for an injury that's more acute, post training soreness. If someone gets banged up during the game, and I need something quick to apply during halftime, I'm going to use a gel. Now, creams are more of a balance of oil and water. They absorb a little bit more gradually. They offer more moderate onset and they last a little bit longer. And the consistency of how they work tends to be a little bit better than gels. So you won't have to apply it as much. Moving on to more ointments. So ointments are more oil based and occlusive. So they form a really good physical barrier around the skin. They may not, again, absorb as fast as gels and creams, but at least the beautiful thing about ointments is that they tend to last a little bit longer than your creams or gels would. Then when we think about patches provide more of that sustained and controlled release effect. So if I'm thinking about an injury that consistently is lagging and I don't need to necessarily provide pain relief right away, then I'm going to use a patch because patch, again, provides more sustained release, doesn't work as fast, but at least it prevents the individual from having to reapply a topical therapy constantly. So, in short, if you want something very quick, fast acting, you'll use a gel. If you want something kind of in the middle, you'll use a cream, something more long lasting. You'll point to more of your ointments and patches.
That makes sense. The ointments seem to get greasy sometimes, I notice. They just sort of smear on your clothes and
They do. And you have to watch out when you use them also in the sun, right? Is because you use too much of it in the sun. I mean, your skin can almost feel a little bit burnt.
yeah, and the capsaicin patches, I wipe my eye before after putting them on and getting it on my hand. It's like that's not a good thing either. Definitely warn against that. And so a lot of people hear the term compounding, but don't really understand what that is. And can you explain what is pharmaceutical compounding and why can topical compounds play a pivotal role in sports medicine?
Yeah, so compounding is pretty much, I always like to use the analogy of cooking. You're getting all your raw ingredients, you're putting it all together, and you're making your final product, right? You are essentially the chef. So, pharmaceutical compounding is the process of pretty much customizing a medication specifically for that individual patient. It's not commercialized. And so, it's not me going to a CVS, Walgreens, or a retail pharmacy, pulling a medication off of the shelf, counting it out, and giving it to the patient. No, it's the individual patient essentially saying, hey, I have X, Y, and Z wrong with me. Pharmacist kind of creating a product that essentially is tailored to that individual patient. And so that can be in the form of changing a cream that's only commercially available and someone saying, hey, I don't like a cream. I want it in the form of a gel or an ointment. Or that can come in the form of a concentration that's only commercially available and saying, hey, I don't like that particular percentage. I want something stronger. We see this a lot in sports medicine with diclofenac, where diclofenac is only available in 1 and 3%, right? And so some athletes or practitioners will prefer a 5% or a 10%. And so in that case, that's when compounding would be appropriate. And then the last thing about compounding that is very unique is that you can combine multiple active ingredients together. So, what exactly do I mean by that? So, I'll use the context of athletes in sports medicine. So, we know that athletes have these very complex pain patterns. And so they can have, a muscle injury, their tendons could be bothering them, their ligaments can be bothering them, they can have some muscle aches. So, in a case like that, you can combine like a anti-inflammatory, like a diclofenac. They're also having nerve pain. You can combine like a gabapentin. They're having muscle aches or they're having muscle spasticity. You can combine like a baclofen. And so essentially you can combine all these different active ingredients into one final product to target all those different pain pathways that essentially the athlete can be having. And then, the beautiful thing about it is that you can use certain bases. And so there's different bases in compounding that essentially absorb better than others. A popular base that comes to mind is like a lipoderm base mixed in with all those different active ingredients, helps better with the absorption, consistency, and the therapeutic effect of the medication. So compounding, it's a very unique thing. I will say the downside about compounding, if there is any, is that insurance doesn't like it, meaning they don't cover it. So you will pay a little bit of a premium for it, but for something that is tailored specifically for an individual that can be very therapeutic, I think the price is worth to pay.
Yeah. Yeah, it seems like it to really customize it. That lipoderm, is that a cream based or what when you said that you add in a lipoderm for the compounding?
Yeah, so that's more of a cream base.
Cream base. Gotcha.
Yep.
Okay. So what are the most common or effective compounded topical combinations that you see in athletes typically?
Yeah, so it's all based on injury, and so if we have an athlete that has more tendon or joint injuries that want to use more of an anti-inflammatory cream or ointment, they'll tend to use more of like a ketoprofen or a diclofenac. The difference between the two, ketoprofen is a little bit more lipophilic than diclofenac. And when we think about our skin, right, our skin is made out of fat cells. And so we want something more lipophilic to penetrate the skin tissue better.
Interesting.
And so when we think about also nerve pain, right, someone may want to use a gabapentin, right, topically to treat any type of nerve pain an athlete can be having. If we have an athlete that has muscle spasticity, we'll see a combination sometimes of a baclofen and a cyclobenzaprine combined together. And then one that's becoming very popular, or actually it's been popular for a while. It's just come in different forms. Is more of your hemostatic agents or your cut creams. So that can be, mixed with a vasoconstrictor like phenylephrine, combined with a lidocaine to help numb the pain, mixed with a antibacterial agent like a bacitracin.
Oh, that's
Um,
interesting. So like a turf burn or something, or you might use that for a superficial wound.
Correct, or like a laceration,
That's
abrasion.
right. Yeah.
Yeah. And so we actually see that quite a bit in hockey, soccer,
Yeah.
wrestling. Actually, wrestling you'll see it quite often because wrestlers always have lacerations somewhere.
Yes. Yeah. How about the cauliflower ear? Can you cure that one?
Right.
No, that's interesting. I have not used those topically for lacerations or wounds, but good
Yeah,
to
it's
interesting
popular.
concept. Yeah. So I want to touch on the regulatory side now. It's a big issue for competitive athletes. And what do the NCAA and professional sports guidelines look like with respect to these topical agents? And are compounded topicals covered by these certification frameworks?
So I always say when it comes to, and I get this question actually quite a bit too, is that when it comes to topical agents, if it's something that's permissible or not in the NCAA or any of the professional sport leagues, it really comes down to the active ingredients or even some of the inactive ingredients that are in some of those products, right? And so we understand that with topicals in general, it's more of a local effect and it doesn't reach high blood levels. And so when we're thinking about any contaminants or banned substances in there, someone really has to use a lot of it. But I will say, for the most part, we really just want to be careful of all the different active ingredients in there. And so I'm looking for, are there any stimulants, anabolics, growth hormones, anything to that nature? And I'm asking the right questions, right? Wherever I'm getting that compounded medication from is, hey, I need a list of all the ingredients, the strengths. I need transparency essentially. And then going through that NCAA banned substance list and checking off to make sure nothing is banned. I will say, for the most part, like a lot of your anti-inflammatory or analgesic creams, those are typically pretty safe is because the ingredients are pretty basic. But once you kind of go off the cuff and kind of creating these unusual compounds, then it's very important to fact check. And this is where the importance of a team comes in. Making sure you have access to your athletic trainer, dietitian, your primary care doctor. So that way they're also doing their due diligence and being used as a safeguard to protect clean sport and integrity.
Yeah, like getting it lots of eyes on it, right? Just to make sure no one's missing something or there's a new compliance rule or something. And I feel like things are always changing. And so I agree having, the athletic trainers, the physicians, everyone keep an eye on that as well as a pharmacist to make sure we're not missing something.
Yeah, and if you're getting it from a compounding pharmacy, if you really want to do your due diligence, I always say, make sure that they have certain certifications, right? So there's certain certifications out there called, like, for example, PCAB, Pharmacy Compound and Accreditation Board, which was really more of like an independent third party review of the compounding practices, training, quality insurance. And then sometimes there's another certification called NABP, which stands for National Accreditation Board of Pharmacy, which makes sure that the compounding pharmacy or the pharmacy in general is being compliant with federal and state laws. And these are really good certifications to check if compounding pharmacies have, just as another layer of protection. Because to me, it says like, hey, this pharmacy is doing their due diligence, going the extra mile to making sure they're doing everything the right way from an operational standpoint and from a compliance standpoint.
Yeah, that's a great point. Does SportPharm go through the independent certification or third party testing for athlete use?
Yeah, so our compound and pharmacy does actually have the NABP certification. I will say for the OTC products, with OTC, at least topical products or OTC products in general, they go through typically they ran through an FDA manufactured facility, and it goes through what's called a OTC monograph, which pretty much means that the ingredients in there, they're approved, the concentrations, the labeling, and so what's on the back of the label is exactly what the company says it is, the concentration strengths, are making sure they're actually there. And then we also prioritize additional quality control measures to support safe use in athletes by doing some more of those independent testing.
It's great. A question you probably get asked, I get asked all the time about CBD rubs and creams, and based on on the research and your clinical experience, do they actually work, and are they standardized?
For a while it's been more anecdotal, but I will say research is constantly surfacing and emerging when it comes to CBD, more on the topical side for localized or chronic pain. There have been a few small human studies and early athlete data that can suggest CBD can improve pain and function in certain situations. And for the most part, it's generally well tolerated. I will say with any of those CBD rubs and creams, go on the NSF Sport certified website, also Inform Sport. Make sure you're getting a cream or a rub that probably has those certifications on there just to kind of play it safe.
In your experience, have you heard anything good or bad from athletes about it?
To be honest, I'm actually hearing more athletes use it.
Yeah.
I've actually had a few inquiries asking if we can compound CBD essentially with, you know, ketoprofen or diclofenac. And so it's becoming actually pretty popular to kind of help mass pain for a lot of different athletes out there.
Yeah, interesting. So do you guys customize it? Do you guys compound it?
So unfortunately we can't. So essentially since CBD is considered like an OTC product, we can't put like an OTC product in other prescription grade products.
I see.
Yeah, it's not FDA approved.
Yeah, I got you. Okay, but somebody can mix it, I guess, on their own if they
Their own cocktail.
make their own cocktail.
I wouldn't be
Interesting.
surprised if they're doing it already.
I mean, I guess the question that I've always had, from the oral CBD and the topical stuff is, are they standardized? And when you have this regulatory environment, you never know what's mixed in with something, right? So we've got a
You
lot of
really
athletes
don't.
doing the oral CBD, but I'm like, you don't really know that nothing's standardized.
That's so true. For the most part, sometimes it could just be the wild, wild west out there, right?
Yeah,
So,
no, that's true. Sorry, so it has some concerns.
yeah,
So if you could leave these athletes or clinicians or listeners with a few practical takeaways about choosing topical therapies, what would it be?
I would say when it comes to topicals, make sure that you're working with the right compounding pharmacy. If you are using a compound, to make sure they're doing their due diligence and assisting you along the way of therapeutic options for your patients. For some of the OTC products out there, again, don't focus on the brand, focus on the active ingredients and how it's being effective for some of your athletes. And then, doing your due diligence and your homework, right? Making sure that whatever products are being used, it's not violating any of the anti-doping or drug policy out there. And so that's really going to come with trusting, your counterparts and your healthcare professionals that are on your sports medicine team to make sure they're protecting you and safeguarding any banned substances that can be inside of some of these products.
Brandon, this has been great. Thank you so much. Where can listeners learn more about Sport Pharma and also your work?
Yeah, so you can go to sportpharm.com. That's our official website.
Sorry, Sport Pharma. I said Sport Pharma.
We get Sport Pharma, Sports Farm. Yeah, sportpharm.com, or you can visit us on Instagram, SportPharm Official. We're on LinkedIn. We're on Facebook. We're at a lot of different athletic training events. And then you can, of course, find me on LinkedIn, Brandon Welch. I post a lot of different content on these specific topics. So there's a lot of different ways you can find us.
Well, that's terrific. I'm sure our listeners will be reaching out to you. And thank you so much for bringing clarity and depth to a topic that athletes are constantly asking us about. And to our listeners, the key takeaway is that topical therapies can be powerful tools when used strategically and understanding the formulation, the delivery, and the regulation. And so if you found today's episode helpful, please consider subscribing, sharing with a teammate, a parent, a coach, and continuing the conversation around what it really means to support the whole athlete. Until next time, this is Blueprint of an Athlete, where science meets sport.